I'm good. Ahmed. It's so nice that we can do this together here today, because actually I was always thinking that we have a good, somehow a good relation to each other. Yeah. How long do we know each other? I think I met you first time in Be Medical Suites or so. I think it's probably 5 years.
Yes, I believe it's 5 years ago. Yeah. And it was actually a very, I call it funny, or it's really very interesting. I was actually looking for you to meet you, but you request a navigation. But that time I'll not be able to meet you because you were very busy with your patient.
Yeah.
Okay.
Yeah.
So you told your secretary that you are very busy.
Yeah.
Then you have the next day. I have a next day surgery.
Yeah.
And it was you.
Yeah.
I don't know that it was you. And we met in the surgery.
That was when you were working with another company, I think, yeah? Or was it the same company?
Same company.
Is it your company?
Yes.
All right. Yeah. Good. Okay. Mabruk.
Thank you.
So
Frankly, it's for my father. The company is for my father. But I run the show.
Yeah, sure.
I run the full show.
That's my guessing, and you run it well, I'm pretty sure.
Thank you very much. Thank you very much.
But what's the name of your company, actually?
La Vie Medical Store.
La Vie.
La Vie. It's a French name.
Yeah,
called Life.
The Life. La Vie. La Vie en rose.
La Vie.
La Vie en rose. La Vie en rose.
Yeah, it's a very famous
song.
Song, and there is actually
movie?
A clothes shop, very famous clothes for La Vie en rose.
Cool. Do you speak fluently French?
No.
But you just like the name La Vie.
If you want more to know about how the name comes from, I can also go.
Yeah, tell me. It's interesting.
Actually, there was a cartoon movie. I was really fall in love while I was a child. He called in Arabic كان يا مكان الحياة. So there is Al Haya drugstore here, so I can't take the name.
Yeah.
So this cartoon movie, I see it on the original language. It was French, so it was La Vie. So from here I took the name.
Nice.
From cartoon.
Really good. And now what I like is your navigation system. Yeah. And what I liked even more when I met you, now I remember that. Yeah. That navigation system, how you provide this, yeah, because everybody knows navigation. So there is navigation that most of the listeners will know from, for example, navigating through the traffic.
The traffic, yeah. This is the idea all come from. So everybody knows, all the humans knows about navigation, about GPS. So GPS is what? Is just you want to go from one place to another place according to your map, to your country, to your city. And the cities are different from different cities to cities. For example, Dubai is different than Abu Dhabi, different than Hanover. So each city has its own roads, maps, everything. Okay. So this, what we allocate the navigation into medical field, the same concept of GPS. So what is the navigation medical field we are speaking? It's an application medically of GPS, Global Positioning System. The map in our in medical is the CT scan of the patient.
So basically every patient has
his own map, which is the CT scan.
So you need to have a CT scan first before you can have a navigation.
That's right, because you need to have the city.
Yeah.
Then you do the navigation for the city.
Yes.
For the people who use the navigation system.
So I will be the doctor, the surgeon who uses your navigation system to navigate through the map of the patient.
That's right.
Basically.
Extremely right. Precisely.
So the patient needs to provide me first with that CT scan.
Exactly.
But most of the patients anyway need to have a CT scan to get an insurance approval for their surgery and a second opinion and so on. And also we need to do the CT scans to know exactly what we actually need to do. Yeah. And often I find findings which, well, let's first come to that. I'm an ear, nose and throat surgeon, and I'm mainly interested in navigation in the nasal sinuses. And to explain that, the sinuses they have some principles but they are different with every patient. And you cannot just like, let's say in former times, there were more surgeries where one surgery fits all. Yeah? And some people, they just have bad luck during a surgery that their anatomy is somehow different and then something happens. And now all surgeries are more depending on accuracy and on millimeter of accuracy. And since we do surgeries also more minimal invasive through endoscopes and through small cuts and so on, there are multiple, we call this applications, so multiple reasons or uses for the navigation. So please, can you tell us what are the uses for navigation?
So, frankly speaking, we really advise surgeons to use the navigation, especially for the cases which is very hard, which is, for example, revision face, if they have some skull tumor, some fungus which is really near the optic nerves, and so these areas the surgeon will be reluctant to go on a deeply. Also, we are very care about the anatomy, the fresh anatomy of the patient, not to cut it or not to touch it.
Can I interrupt you?
Yeah.
Because you use already many words that maybe people don't understand. So we have, Ahmed was just talking about the situation, for example, in the head.
Yeah.
If you go into the sinuses of the head, you go actually through the nostrils.
That's right.
And operating through a nostril is like a small way to go in. So you operate with an endoscope, and then you see through the scope, you see the anatomy unfolding in front of you, which is deep in the head. And to reach to certain structures that you, for example, you just mentioned even bad infections with fungus or growths that can happen there and that can be really, let's say, threatening for the patients, then you need to have a really reliable pathway of navigation.
That's right. Yeah. So what we provide is we'll give the surgeon a map. So in very simple words, we will open it's literally, we will open the patient head, in front of the doctor to read exactly where he is, so he can see his path, endoscopy, and his surgical instruments, where he reaching inside his patient head, so as to be very, very accurate and very very calm, not in stress while he performing his surgery.
Yeah.
So he exactly know where to cut, where to go, where to take, and but it will be simultaneously while he is using his endoscopic screen, he can see the same screen of the navigation.
And here comes the whole thing sounds like a miracle somehow. Yeah, I mean, before whoever was a surgeon before navigation came on the market, it was unthinkable that a system like this could ever exist. A little bit like also before the car navigation came on the market, it was also unthinkable that a system would exist that could guide you through foreign roads, or through a foreign city.
Yeah.
But how does that actually technically work, that you can provide this relatively or actually very accurate map of my head, for example?
Very good question. So what we do is we take the map of the patient, which is the CT scan, and also we can combine the CT along with MRI. Okay.
But MRI is not so...
It's for the soft tissue, but we have this option. But what we are doing is to take the CT scan of the patient, which is the map of the patient, okay, which he has a lot of complications, for example, to do the surgery. For example, we'll take a revision face surgery. Okay, we'll take
a revision face surgery means patient had already a surgery
That's
of the nose and sinuses
That's
before. So the sinuses, Jube and fear. Yeah?
so the anatomy of the patient is not
Not natural.
not natural.
Yeah.
Yes.
Yeah.
So the doctor, by doing the surgery, he will see anatomy of not a normal patient because he did a lot. Not this is not the first time of the patient to do the surgery.
Yeah.
For example, sinus surgery.
Yeah.
It will not. The doctor or the surgeon is going to operate the surgery. He will see something which is not normal from the normal patient who are doing the first time the surgery.
Yeah, and he would not always have also the report of the previous surgery.
That's
he
right.
would not even know what the previous surgeon has done.
Yes. Yeah. And a lot of surgeons really told us that I'm going to do the surgery, especially for the revision phase, but I don't know the record of the previous surgeries and what is going on.
Yeah.
So he go inside the nose
Yeah.
of the patient and he see huge complications, a lot of anatomical structures is there, and he somehow got lost. So especially for the areas which is very sensitive, which is near the eye or under the skull base. Somehow these areas are very sensitive, and maybe somehow it is life-threatening for the patient.
Yeah, it's not. I mean, of course, as surgeons, we know exactly in which area we are, roughly. But sometimes we need to be exactly accurate in every angle, and people need to. Well, what I always I'm surprised of. Actually, I wouldn't have known it as well if I wouldn't have studied medicine. I wouldn't know that the skull is hollow. Yeah, for example. Yeah, just speaking about my topic, I know you do this also for brain surgeons, and you do it also for orthopedics, spinal cord, or so there are various different medical fields who use navigation.
That's right.
But in our medical field. So that means the sinuses, we use the navigation because the skull has its hollow cavities, which are good to keep the weight less, basically. Yeah? If it would be compact bone, it would not be so sturdy and it would be heavy. And also the sinuses provide some kind of temperature regulation of the air that we inhale, and also a regulation of the humidity. So the sinuses contribute to the airflow as well, and they are distributed in the two maxillary sinuses, then the two frontal sinuses. Then we have two big sphenoid sinuses, which are deep inside, and between there are many, many little cells. They are just not, they don't have all a simple name or a special name. They are just regarded as the ethmoid sinuses. And that's multiple cells. Usually it's 4 or 5 cells that come together there. So the entire cell systems, which are all interlinked, is like you have a piece of a sponge, of a hard sponge, basically. And then I ask you, how do you want to navigate without a navigation system through a sponge, from one cell to the other cell? It's not so easy.
Yes.
And it's easily also to forget one of the cells.
Exactly.
Yeah? Maybe you have an infection in a cell that is more on the right side, or more on the middle or so, and you just pass your way through this and it looks like everything's healthy, and you wouldn't know that behind this there's an infection.
Yes.
Yeah? And there comes the roadmap, and the roadmap has a little sign. Here is something. Yeah. And you need to go here. Yeah. And how do I know that I am there? Now I give the ball back to you to explain that.
Thank you. So for our system, we are using the trackers. Trackers, which we use our trackers as a props. So you have a prop for a maxillary sinus, we have a prop for a frontal sinus, and we have a straight prop for ethmoid and the other sinuses. Also, whatever surgeon is using any tool, like shaver, like suction, whatever tool, it will be integrated to the system, and it will be part of the system like the probes which is pre-calibrated in the forehead.
Here I need to interrupt you.
Yes.
So the probes or the instruments, whatever instruments the surgeon likes to use, basically as a surgeon, we are like a driver. Well, this driver likes the Lamborghini, the other one likes the Mercedes, then the next one needs a truck. Yeah. So for different tasks, you need different cars, and the surgeon needs different tools. And all these tools can be equipped with a navigation.
Yes.
So they have, you call it a tracker.
We call it the tool will be integrated with the tags.
Yeah.
Okay. And it will be part of the navigation, which at the end called a tracker.
Yeah. So my car, is it also equipped with a tracker? If I drive my car through the navigation?
Yes.
Yeah.
Because you installed the navigation system in your car.
Yeah.
So the car is a tracker now.
Yeah.
It will be integrated with the navigation GPS with the satellite, and it will be the tracker on the map. Same concept. So the car is the tracker here.
Yeah. And in my case, if I do a surgery, my tool
your tool is the tracker.
Is the tracker. And actually, it's not the entire tool. It's the tip of the tool.
The tip of the tool. If the tool, you will see the tip of the tool, which is where are you ending inside the patient sinus or the area where you want to reach.
Yes.
So the tip of the tool is the ending point where you are reaching inside the patient.
Yeah. So then so your system will know now who's the tracker.
Yes.
Yeah? And it will literally also find out where is the tracker.
Yes.
Yeah? But then, how does the system know from the CT scan that the patient gives me? I mean, when he was having his CT scan, he was somewhere in a radiology clinic, standing, lying, or whatever, or in a certain different position, and now he is on the operation table. Maybe 3 weeks later, maybe he looks different now or so, or something has changed in him. How would the system now identify the map from the CT that he made somewhere else with the reality head which is lying for the operation?
In the CT, which we took, and see, again, CT is his map. Okay, so the CT scan of the patient which we took, there is sagittal, coronal, and axial images.
So that are the 3 dimensions.
3 dimensions.
From right to left.
From right to left. From
front to back.
Yes, front to back, and from down to up. Okay, this is the images we integrated in the system. The system, they have his own algorithm to read these 3 we call it images, okay, and it generates a 3D dimension of the patient. From this algorithm, the patient head or the same head of the patient will be inside the system. Then we will integrate, or we will attach a reference point in the forehead of the patient. Okay, because now the head of the patient is our map. Because the map is the CT scan of the patient, which is his head. Okay, so this is the map of the patient, which my map different than your map, different than anybody has his own.
If I understand that right, so the CT scan is a map, a 3D map. Because it goes also inside, because it shows also the deeper levels.
Yes. Yes.
So it's not only the surface.
No.
But the system, the algorithm, can create a 3D image, which is like a sculpture of the patient's face. It looks identical to the patient's face.
Yes.
Only the hair is not visible.
Only the hair is not visible.
Yeah. So it looks identical to the patient's face and the features, and then you put a
reference point
on the forehead.
On the forehead of the patient.
Yeah.
Then this reference point.
That doesn't matter where it actually is. From this, you measure then certain
points.
distances to the which are fixed landmarks,
Yes.
basically. Yeah?
So we choose 7 fixed landmark, which is obvious for every patient.
So, for example, the Burj Khalifa,
Burj Khalifa is a fixed mark.
tip of the nose.
The tip of the nose in the city. Exactly.
Yes. Yeah. So the Burj Khalifa here. Yeah.
So there is one Burj Khalifa here.
Yeah. Yeah.
There is Burj Al Arab here.
Yeah.
There is, for example, what else in Dubai?
The palm.
Palm maybe here.
Yeah.
So these areas you choose it as a reference.
Yeah.
Then you calculate where you are, where is your tool, are far from these reference points.
Yeah.
So this is what we do.
Yeah. So basically, the navigation system knows always where is the Burj Khalifa standing. Yeah.
So Burj Khalifa will, or the reference point for you. Let's say the reference point is the forehead.
Yeah, and that point is, let's say, the reference point in the city would be, let's say, here in our clinic.
The reference point is the point where you start your navigation.
Yeah.
So if you want to go from your clinic,
Yeah.
Dr. Marc Mueller clinic,
Yeah.
is you want to go from here to Burj Khalifa.
Yeah.
So your reference point for GPS is your clinic.
Yeah.
So your clinic, the GPS will measure how far Dr. Marc Mueller clinic from Burj Khalifa.
Yeah.
And he will route you the simplest and the cost-effective and the easiest way to Burj Khalifa.
Yeah.
Exactly what we are doing here is the same.
So we put
So
the reference.
we put the reference point.
This is
in
the
forehead,
clinic Marc Mueller.
is the Marc Mueller head.
Yeah.
Okay.
Yeah.
Then we will go the patient. Then we will do the references for all the face of the patient.
Yeah.
We will mark the eye 7 points, which is the eyes and the nose. Okay. Then we will take we will do the 130 points as a trace for the face. So the reference.
This is called the calibration. Is
This
it
is
correct?
called the registration.
Registration.
Yes.
Registration. So the registration will actually follow the outer facial structures.
Yes.
That are also somehow already known by the CT scan. Yeah.
Exactly, because we do have the 3D dimension,
Yeah.
which was taken from the CT images.
Yeah. That's why it is so important that the radiologists don't miss to put also the tip of the nose. It's like they cut off the tip of the Burj Khalifa. Yeah. And then the antenna is not there.
Yes.
The system will not know exactly where the Burj Khalifa stands.
Yes.
Yeah. So then you have, then you go and do all the references, and the more reference points you have, the more accurate,
you get.
So because, let's say, if you had only Burj Khalifa and the frame, or Burj Khalifa and Burj Al Arab, that would not be enough. But if you have, let's say, 150 houses or reference points in Dubai, and you calculate all of them to their distance to the Burj Khalifa and to
Burj Al Arab
and to the medical clinic.
Yeah, and the reference, which is your reference.
Then you will know exactly
what is the easiest way, how to go, and that all the circumstances which is in this, what is going on for the traffic, for whatever, if there is the accidents or whatever, you can see while you are going to your destination.
Yeah. Of course, there are no accidents on the face. Yeah.
We call accident is like some tumors or fungus. This is, for example, you can see as accident.
Yeah. Okay, good. So I have now put the reference points in the navigation.
Mm-hmm.
Yeah. So that's now there. And then it gives me what kind of information, how accurate I am, for example.
How accurate now? We as I said, we will fix 7 points on the patient face, which is the start and end of the eyes, and here 3 points for the nose.
Why do you use exactly these points?
Because it is very obvious for all the patients.
And isn't it also because these points they have some kind of a bony structure or fixed structure?
Yes, there is bony structure also.
So you cannot, they wouldn't change because
between this point and this point, there is point.
Yeah, let's say if the patient has the CT scan done. And within the 3 weeks, he falls on his nose, and the nose is not standing anymore in the same place where it was before. Yeah. So maybe the tip of the nose or so. That's like the Burj Khalifa would have moved through an earthquake or so, 5 meters to the side. Yeah. And then it would not be an accurate reference point anymore. Yes. And that's why you need to make many references
points so as to tell the machine that this is the exact place now of the nose, which is the current exact place of the nose. This is the current exact place of the eyes. This is the current exact place of the forehead. Okay, and you will start.
And the beauty is, once the system knows these, it knows all the points exactly.
Exactly.
And that means also inside the head.
Yes.
And then
because it is a reflection between we are working on the 3D image which the system generated from the CT scan.
Yeah.
So all the 3D image which is come from, it goes all and deep inside the sinuses and all the anatomy which the patient has.
Yeah.
So once you put one reference in the face, in the eye, it goes all the way to the CT deeply inside the whole face or head.
Head, yeah. So and then then it's actually ready to go. Yeah?
Ready to go.
And then I can see on the screen, I usually use a split screen. I see my video, and next to it I see the navigation, which is like movie. It's like it's following with a CT scan. So if I go to another scan, it shows another scan, and it shows always the scan where I'm in. Yeah,
exactly.
So I'm jumping from the first 3 millimeters to the next, and so on. Yeah, but you need more accuracy with the CT scan. Yeah, the CT scan needs to be very, very good. Yeah,
the CT scan needs to be very good. The slice, we advise the radiologist to take. We have protocol, but we work with all protocols. But for the CT scan to be good and for the surgeon to see really a good image, there is a certain protocol which the radiologist has to follow.
And that is
and we are speaking about the cuts of a minimum 160 cuts with a thickness of 0.4 millimeter.
0.4 millimeter.
Yeah.
So every 0.4 millimeter I come into a new cut.
Yes.
Basically.
Yes.
That's on the other side, it's quite a lot of radiation.
Not that much radiation because it's just one radiation, one capture of the CT, and that's it.
Yeah.
These days, the technology for CT is, minimize the radiation capture. So with a very minimum radiation, you can generate a very good images.
But of course, this is the radiation is only once.
Yeah, only once.
And that's why also for our listeners, I cannot repeat that often enough. Every patient, I mean, at the end of the day, it's your body, yeah. And even if the doctor told you go here for CT scan, go there for CT scan, it is some radiation. There's still something. And then if you go somewhere, it should be the right method and the right moment to do. Yeah, you should think 3 times, how can I use this scan once it's done for my future?
Yes. Yeah, sure.
So if I just go there for let's say a doctor wants to know if I have this or that, I think this is not really the best way to do it. I think you should better go when you have a more accurate question to ask. Because I observed that many people are sent to a CT scan just to know, which is already obvious, maybe that they have a sinusitis, for example. No? Oh, your phone is ringing.
No, it's okay.
You're such a busy man, yeah.
That's fine.
I took you out of your daily routine, yeah. How late is it now? It's 12:40. Yeah, so then we have this navigation, and now the surgeon sees on the split screen the image of his camera. Yeah, because we are as I said, me as an ENT surgeon, we are operating through the nostril.
Yeah.
So that's a small hole, and there is not much space in the nose. So we go usually with a 3 millimeter or 2.5 millimeter endoscope. And so that's the diameter of the endoscope inside the nose, and try to not damage anything because it would start bleeding. The nose is very sensitive. Everybody who knows that if you hit your nose once just frontal or so, it starts bleeding. Yeah? Or if you pick too much.
It will start. Actually, I had a lot of bleedings once I was a child. Any hit, I had to bleed.
Yeah, but you're not a nose picker.
No, any hit, it's not. But really, any hit, it will start bleeding, especially also and if I play under the sun.
Actually, it's usually a sign of inflammation in the nose. You know that, yeah? Yeah. We should make a CT scan.
That was when I was a child.
No, as I just said, so don't do always a CT scan just from the start. Just figure out what you have, if it gets better with medicine, and then if nothing helps anymore, and we plan for a surgery, for example, then it's the right moment to do the scan, and then do it well. Do it with 0.4 millimeter distance between the slices, yeah?
That's right.
And starting with the entire tip, so that the top of the Burj Khalifa is not cut off.
Is not cut off.
And then you have a very, very accurate roadmap. And then you can go to any doctor and say, hey, look here, I have the CT, this is my roadmap. And it's so accurate, it shows even the walkways between the buildings or whatever. Yeah, so it's very, very accurate. And now, as a surgeon, I have this super accurate tool. And your machine, your navigation system, which navigation system are you recommending?
We are using a Navi ENT, which is a Canadian navigation system from the manufacturer called Claronav. It's a Canadian machine, and it's very reliable. We don't have any disposable tools. All the tools are reusable. Up to 10,000 cycles, which, frankly speaking, can operate for one single machine, 10,000 cases.
That's amazing.
Yeah.
That's amazing. Who makes 10,000 cases?
With a very accurate results.
Yeah,
actually, it is the accurate.
I know that actually, and I like this, and that's why you're here.
That's why we are friends. You are one of the surgeons. We start with you doing the navigation surgery.
Really?
Yes.
Yeah. I liked it so much that I wanted to have it always. Yeah. There is, of course, like with every navigation, also like the navigation that you have in the city, you cannot always rely directly on the navigation. So you have this split screen, as I wanted to say, and you see the image, and you go with the tool inside, and the navigation tells you you're here or there. Yeah. If as a surgeon I would completely rely on the navigation, I could sometimes be wrong, because there can be some inaccuracies that come from the movements of the head or so, or maybe the marking point has moved or something like this. So you have to always double check if it's really true what the navigation says. Yeah.
So the surgeon, we will be with the surgeon all time of the surgery to make sure that everything is on the right track, helping the surgeon if he needs our help to ask about the system. Okay, surgeon, he has full power to do the surgery because he is godfather for the surgery.
Yeah.
But we are speaking about the system. We will be helping the surgeon for any which call inefficiency of our accuracy of the system.
Yeah.
To regenerate the same concept of the registration, which will take less than 30 seconds.
You know, this is actually what I like so much with you. First of all, I mean, we meet through so many surgeries. Yeah, we went through surgeries together. Yeah, and it's always nice to have the technician. It's like you're the pilot and you have a navigator on board or so. Yeah, it's really cool. Yeah, and you help because not everything goes absolutely smoothly. And then it is very nice to have someone with the knowledge of the technology and who's saying, no, we need to fix this or that, and then it works perfectly,
Perfect.
accurately. And it is very, very useful. My clinic partner here, Dr. Eduard Jans, he had the first surgery with you recently.
That's right.
And I asked him, now, how was it? Yeah, and he said, I want to do navigation with every surgery now.
Thank you very much.
Yeah, he liked it so much, and he says it's so much comfortable to work with you. Yeah, it was really, he had a very, very good experience. And it was the same for me. And also, I would like to use navigation actually for every case.
Actually, using navigation will give the doctor a very comfort zone while he is doing surgery.
Yeah.
The stress will be minimum stress as much as it was. And also for the patient, the healing cycle for the patient will be very fast.
Yeah.
And the cost of the surgery will be also dramatically goes down.
Yeah.
The time of surgery also, you for the surgeon, instead of taking, for example, a surgery of 3 hours, it will go down as well. And you see it. Instead of 3 hours, it goes by 2 hours, for example, or sometimes 1.5 hours. We have recently also one surgery with one of the doctors here. He really literally told me this surgery without navigation took me around 4 hours. We do it with 2.5 hours with navigation because he exactly know what he's doing and he was really relaxed while he's doing.
I mean, the surgeons always know what they are doing, but he exactly knew where he was.
Yes. So he instead of just he was new because it was a revision phase, and it's not only one time. It was the fourth time for revisions.
Yeah.
So the complete anatomy of the patient was abnormal.
Yeah. And these surgeries are often necessary because somehow one cell or the other cell has been forgotten, and to find this cell, you need the navigation for that. And I believe actually if you use it more often, even for cases where you actually not necessarily need to use it, where you could do also well without navigation, it's still good, because if it becomes a routine, you're getting better and better with using it. And so I love it. I love to use your navigation system. It's really good.
I really would thank you, a big thank for you, because you are one of the, as I said, you are one of the earliest doctors which you use our navigation, and we really, it was very, very thankful for you, and you support us a lot.
There is one structure in the sinuses, which is let's say like a little bit of a tricky structure, that is the opening to the frontal sinus. Because you have only very narrow space there, and you need to navigate through a very thin hole towards the frontal sinus. And to find that is so super cool with the navigation. It's just really amazing. Yeah, that's good. Yeah, Ahmed, is there anything else we need to tell the people who are interested in navigation and surgeries?
We are nowadays launching actually our new navigation system.
Ah, really?
Yep. Which is combined between ENT surgeries, cranial surgeries, and spinal cord surgery in one system.
Oh, good.
Yeah.
That's amazing.
Yes.
So that can be shared by doctors.
Can be shared by neurosurgeons and the ENT surgeons.
That's amazing. Good.
And the accuracy extremely fantastic.
Yeah, but for example, we never bought the system from you. You come and rent it.
We rent it.
Yeah. You come and rent it, and it is somehow more comfortable. Yeah, I think because you come with it. I think if I would buy it, you wouldn't be there anymore.
I will be there also. We support our prestigious doctors.
Thank you.
Till the maximum.
Okay, Ahmed. Then I'm looking forward for the next case with you. Yeah, and then we meet in the operation theater again.
Sure.
Thank you for coming and being on Dr. Marc's Second Opinion. And I hope the listeners know now more about the navigation system that we are using for navigation, or to navigate through your sinuses if you need a sinus surgery. And yeah, with this surgery is also very safe then, yeah?
Extremely safe. So no worries from now on to go and do the surgery, because you will be, as usual, with the safe hands. But we give you, the surgeons are always the expert to do surgeries, but we are giving you somehow an extra comfort for you, so as to do the surgery with closed eyes.
Yeah, cool. You could theoretically, but is there also AI involved in navigation already?
Till now, no.
No.
But we are working for involving AI in navigation.
So in the future, maybe
In the very near future.
in the very near future, you don't need the surgeon anymore.
For me, what I believe is, even if the AI is coming, we still need the surgeon.
Why? Why do you think that?
Dealing with humans, still, you have the feelings. As a patient, I'm speaking as a patient now. Okay, so I will not put myself in front of the machines, because I don't trust them till the end of my life. But I trust the humans. I trust my doctor, because there is an interfering between him. There is an emotional, which you don't feel, which you don't find it in the machines.
What do you think if you step in a taxi and no taxi driver is there?
Actually, I don't know, but for me, still, I don't trust the machines fully on my life.
Yeah. How about the metro?
Metro is fine, because you have the metro, you have the track, which is, they go not the here or there. You have the track which is coming back.
But it's a little bit like a crazy feeling. If you sit in the metro and there is no actual driver on the train.
Yeah, we are used to. Yeah. We are used to.
Yes. Okay. Good. Thank you very much.
You're welcome.
See you soon.
Thank you very much for your time, dear Dr. Mueller.
Thank you. Thank you,
dear
forward. Ahmad Bashir from La Vie.
La Vie Medical. Thanks
La
a lot.
Vie Medical.
Yeah. Thanks a lot.
Thank you.